Every one of us have had to deal with stomach pain at some point in our lives. Often, when it happens, if it's not too bad, we simply ignore it. We assume it's just something we ate, maybe a little heartburn or indigestion. We take an antacid and we move on. And most of the time it goes away and we forget about it. But for thousands of patients every year, those minor symptoms are actually the first whisper of stomach cancer. The problem is, stomach cancer is a master of disguise. Data shows that only about 30% of stomach cancers are caught in the early treatable stages. Why? Because the warning signs are so vague, most people, and even some doctors, miss them until it's too late. And here is the real paradox. If one does suspect stomach cancer, the tests to find it are pretty straightforward. More on that later. Welcome to Fighting Cancer. I'm a board-certified medical oncology physician, and on this channel, we break down complex medical topics into plain language to help you spot these red flags early. Today, I'm walking you through 7 specific symptoms that distinguish ordinary indigestion from something much more serious. Symptom number 1 happens right at the dinner table. It's called early satiety. This isn't just not being hungry. It's the feeling of being completely stuffed after eating only a few bites of a normal meal. You sit down hungry, but after 3 or 4 bites, you physically cannot eat another bite. You feel full when you know that you shouldn't. We often dismiss this as just getting older or a shrinking appetite. But medically, this can happen because a tumor is taking up space in your stomach or making the stomach wall stiff, preventing it from stretching to hold food. If this happens consistently, pay attention. Unlike some of the other symptoms which might be due to minor issues, this one is often significant. Please contact your doctor for additional testing. Symptom number 2 is persistent indigestion and heartburn. The key word here is persistent. Millions of people have acid reflux, also known as heartburn. You know, that burning feeling in the upper abdomen or the lower chest after a spicy meal or too much coffee, especially while trying to sleep at night. That's when we reach for the antacids for relief. And most of the time, they work. But if you have been taking antacids or heartburn medication for years and they suddenly stop working, that is a red flag. Ordinary heartburn comes and goes, and as I mentioned earlier, often responds rapidly to anti-acid medication. Cancer-related pain often stays, nagging you constantly. If you are over 55 and develop persistent or worsening heartburn, especially if you've never had it before, you need to see a doctor. Symptom number 3 is upper abdominal pain. Specifically, we are talking about the epigastric region, the area right above your belly button but below your ribs. This is different in character from the heartburn we just talked about. Patients often describe this not as a sharp, cramping pain, but as a vague, dull ache that is just there. It might feel like a gnawing discomfort that doesn't go away after you use the bathroom. Do not ignore pain in this specific location. It could be something benign, such as gallstones, but still should be checked out. Symptom number 4 is unexplained weight loss. Now you're probably thinking, "Doctor, people lose weight for all sorts of reasons all the time. That does not sound very specific." And you would be right, but the key word is unexplained. In the medical world, if you lose more than 10 pounds without dieting or increasing your exercise, we consider that an alarm symptom. This happens for a number of reasons. Since the stomach is directly involved in digesting food, any malfunction can decrease intake of nutrition. In addition, the body is burning massive amounts of energy trying to fight the cancer. Also, the cancer itself is an unwanted guest that is stealing nutrition from the body. In an adult, unexplained weight loss is never normal. This symptom is not unique to stomach cancer, but should always be evaluated. Symptom number 5 is abdominal bloating. We all feel bloated after a huge Thanksgiving dinner, but this sign refers to feeling uncomfortably swollen after eating small, bland meals. If you feel like your stomach is ballooning out every time you eat, it warrants an investigation. Symptom number 6 is a major red flag called dysphagia, or difficulty swallowing. This feels like food is getting stuck in your chest or upper abdomen on its way down. This can occur if a tumor is located near the top of the stomach, physically blocking the passage of swallowed food from the esophagus into the stomach. A related symptom is vomiting, which can happen if a tumor causes a blockage low in the stomach, preventing food from passing into the intestine. So the food has nowhere to go but back up. A clue to the cause of this type of vomiting can be the lack of bile, a yellowish-green, bitter-tasting fluid in the vomited material. Sometimes what is vomited up can be identified as recently eaten food. If you ever feel like food is sticking in your chest or you develop forceful vomiting, do not wait. See a doctor immediately. Finally, symptom number 7 is melena. This refers to black, tarry stools. I'm not talking about brown or dark brown. I mean jet black, sticky, and often foul-smelling. This specific appearance indicates bleeding high up in the digestive tract, where the blood has been partly digested by stomach acid. Partly digested blood is not red, it is black. The greater the bleeding, the darker the stools. While iron supplements or foods like blueberries can darken your stool, true melena looks different. And it is a medical emergency because it indicates significant amount of blood loss that needs immediate evaluation. There are other reasons one could have melena, such as a bleeding stomach or duodenal ulcer, or even malformed blood vessels, but it always needs medical attention to stop the internal bleeding. So let's recap the list. Feeling full fast after eating just small amounts. Persistent heartburn or feelings of indigestion. Upper abdominal pain. Unexplained weight loss. Abdominal bloating or swelling. Difficulty with swallowing. Tarry black stools. Now, please, take a breath. Having one of these symptoms does not mean you have cancer. There are many simple or benign conditions which can show similar symptoms to any of the ones we just talked about. But if you have persistent symptoms, meaning they last for more than 2 weeks, you need to be your own advocate. Remember I said the diagnosis of stomach cancer can be straightforward? That is very true, but the doctor has to follow the clues the body provides in order to perform the correct test. If you have any of these symptoms, your body is speaking to you. Be sure to communicate all of your symptoms to the doctor. Don't let a doctor dismiss you with just another prescription for antacids if you know something is wrong. Ask for an endoscopy. It is the gold standard for ruling out stomach cancer and allows the doctor to get a tissue biopsy of any abnormal area of the stomach at the same time. If you live in a place where an endoscopy is not available, a barium swallow or upper GI series may be possible, but if abnormalities are seen, a separate biopsy would be required. Early detection saves lives. To learn about other silent symptoms you shouldn't ignore, click this video right here to learn about colon cancer signs next. I'll see you there.